Kimberly Angela. I am 25 years old and I come from Aruba originally. And I came here 7 years ago and I went to study at Maastricht University. I initially started with medicine and now I'm currently doing my master's in governance and leadership in European public health. It contains, as I mentioned, the three aspects: governance, which is mostly around the decision-making process. So a lot of lobbying. In health, you have a lot of things that are seem logical to do, but you always have to market it well to the politicians. So that's the governance aspect of it. And there's the leadership, because in order to change an organization or in order to inspire people to actually act on these policies, you would need a good leader. And this is of course needed in public health itself, which is a very new and uprising kind of studies. And I based it on the European context, but everything that we do study, we can also apply anywhere elsewhere on the local, national or regional level, depending on which one is more needed, of course.
So we're talking about the action plan for Bonaire, naar een gezonder Bonaire. One of the themes is overweight and obesity. Could you explain why it's so important to act on these issues?
Well, I believe it's very important. It's something very much common in the Caribbean also, that we have a lot of sugar intake. I think it's mostly due because we have a lot of more processed food compared to other countries like Europe, because we have to import most of our products from the United States. And this has a tendency to lead to too much food intake, too little exercise, and developing overweight to obesities. And from these we get a lot of cardiac problems and can develop diabetes, for example. So it does have a lot of cost at the end that can be prevented. So it's a very much preventable disease that we should work on. The government should make it more community-based. So if you can access the community and tell them on their level why it's important and get the word out there, it would have a stronger effect. So by this I mean, for example, teaching children at school, so starting from a very young age, how to be more involved in physical activity, so have more programs available for physical activity so they can enjoy being active. And also for food health. So knowing what kind of food is healthy. So sugar is bad, so we shouldn't really give or drink too much energy drinks or sodas. Is one thing very poignant in the Caribbean, I feel. And also healthier foods. So we should all eat less red meat and enjoy the fish that we do have a lot more in the Caribbean than in the Netherlands, where the sky is a bit more gray for that.
What could citizens from Bonaire do themselves?
I know for sure that during the midday around 1 p.m. is horrible to do exercise because your whole body is in pain of the heat of the sun. But being active like earlier in the day or a bit more when the sun is going down in the evening is also a good step. So when you come home from work all tired, relax a bit, have a bit of a snack and then go out for a walk. Doesn't have to be always a run. A walk around your neighborhood, a bigger walk in the nature area. Bonaire has a lot more of those, so stimulate people to go on group jogging, for example. That can be something done too. Or swimming, of course, depending on how close you are. But it doesn't have to always be intense, big exercise. It can always start some small. Dus Bonaire, bo saluta de momang, banco mi sa move e hasi mi hopa nos mes.